Good morning. Good morning. Thank you so much for staying with us right here on your Women Radio WFM 91.7. This is Nigeria's first radio station for women and their families. And of course, you're welcome to the program Radio Doctor. This is the 1st of August, so happy new month to you. Thank you so much for staying with us all through the month of July and also being with us right here at the beginning of August. So we hope to end this month and even this year with you. Okay, so yes, you're welcome to Radio Doctor. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise right here on Women Radio. And this comes to you Mondays through Fridays from 10 a.m. My name is Rose Yusuf Kaiser. And today our Radio Doctor is Dr. Ajayi. He's the MD and CEO of ROA Specialist Hospital. Good morning, Dr. Abiola. How have you been?
I'm doing very well. Can you hear me okay?
Yes, I can hear you loud and clear.
Good. How are you?
I'm okay. I'm good. So happy new month to you, Dr. Abiola.
Same to you. I'm happy to be here.
Okay. All right. So for today on Radio Doctor, Dr. Abiola Ajayi of ROA Specialist Hospital will be consulting and advising on uterine fibroids, a common women's health concern. Yes, it is. I think just yesterday I saw a video of a lady who passed on, although not from fibroids, but I heard that, those are part of the things that she was dealing with. So she was always doing these dance exercises and people were always commenting badly on how big her stomach was, and I think she wanted to she went ahead, tried to do something about it, and then it came out that even while she was doing all of that, she had fibroids. So sometimes let's be careful of the kind of comments we make. We never can tell how what people are dealing with. And uterine fibroids is it's something that we've been hearing very common with women. So today we're going to know all about it and what is of concern and where we should go to and how we should deal with all of this on the program today. All right, our phone lines will be open shortly, but in the meantime, you can go ahead and send us WhatsApp messages. You have questions, you have concerns that you would want the doctor to talk about. Please go ahead and send us your questions, your concerns on our WhatsApp platform. All right, 08155 917 917, or better still, you can use 070 317-56537. Those are the numbers to get in touch with us this morning for now through our text messages or WhatsApp message platform. Okay, you can also be a part of the conversation by going to our Facebook, on Instagram, and of course X and YouTube at WFM 917. Log on to our website www.wfm917.com to listen live from many parts of the world, and of course go ahead and download our mobile app and get to listen to us. It's on Play Store and it's also on Apple Store. All right, uterine fibroids, a common women's health concern. That's what we are looking at today. So let's head on straight to the conversation. Dr. Abiola, this is your Women Radio, by the way, in case you're just tuning in. And this is Nigeria's first radio station for women and their families. My name is Rose, and I have a doctor with me this morning, Dr. Abiola, who will be talking on uterine fibroids, a common women's health concern. All right, so Dr. Abiola, can you give us a background, on uterine fibroids and how they differ from other types of non-cancerous growth in women's reproductive, organs?
Yeah, so you mentioned it. It's a non-cancerous growth. Uterine fibroids, we also call them medically leiomyomas. They are non-cancerous tumors. They're made up of smooth muscle and fiber tissue, and they either grow in the uterus or on the uterus. It's the most common pelvic tumor of women of reproductive age. And what makes them kind of special is that they form from the muscle wall of the uterus, and they can be influenced by your hormones. So, as your menstrual cycle goes, the fibers also change slightly, particularly based on estrogen and progesterone. They're solid. When the first time, many years ago, first time I took out a fibroid, and when I felt how dense it was, how hard it is, it's really surprising. The example that you gave in the beginning. A person could look pregnant. Depending on how large these fibroids grow, they can look pregnant. They can look obese. It can really change the size of your belly.
All right. Thank you very much, Doctor, for giving us, a really good background on uterine fibroids. All right, and how it actually gets to look like, or even be, giving us a picture of it. So, Doctor, now for fibroids, are there different classifications of fibroids? In the woman's body, or it's just fibroids, and then the locations too. Is it always in the uterus and the womb, or there are other places where you can find fibroids?
Oh yeah, they're fibroid. We usually classify fibroids based on their location.
Okay.
Where they grow. We have some ones called submucosal fibroids that grow in the inner cavity. And these ones can cause heavy bleeding and fertility issues. Before that, I like statistics. So 70% of women by age 50 may be affected by fibroids, and that's worldwide. But many of them are what you call asymptomatic, meaning they're not having heavy bleeding, they're not having menstrual pain, they may not even have an increased belly size. There's so many times I do an ultrasound or I do a scan now, and you find fibroids, and you ask the woman, are you aware? And most of them, or a lot of them, are not aware. It's only about a third of them that will require medical or surgical intervention in their lifetime. So I just wanted to give that background.
Okay.
So we have, like I said, we have the submucosal fibroids, we have subserosal fibroids. It's really just where they're located. And without turning you into a surgeon, the differences. The main difference is, of course, is that in different areas they can cause different issues. So some women, that's why people that have fibroids suffer from a wide range of symptoms. Either no symptoms, heavy bleeding, some can have fertility issues. Some fibroids are so big that they push on your bladder and make you urinate more frequently, or they push on your bowel and they can give you constipation. It's it really by the location, and then classifying them, or especially by location, is what helps us choose the best treatment path, which I'm sure we'll talk about later.
Yeah. So it depends on the location. Okay, thank you so much, Doctor. You can be a part of the program by dialing 07000 917 917. You can also go ahead and dial 08155 917 917. Those are the numbers to get in touch with us this morning. Don't forget, you can send us a WhatsApp message to 08155 917 917 or 070 317 56537. Those are the different numbers that you can get in touch with us this morning. We're looking at uterine fibroids, a common women's health concern. So yes, we're here to take your concerns, your questions, and all you need to know as regards to fibroids this morning. So earlier, Doctor, you mentioned something that has to do with hormonal imbalance and all of it. So what's let's just dwell on that a little. What's the link between fibroids and hormonal imbalances, particularly estrogen, progesterone levels, and all of that? What's the link there? Because at the end of the day, we know that a lot of the maybe fertility issues that we deal with, or even as women, you get to hear a lot of hormones coming into the picture, hormones and all of it. So what's the link here for fibroids?
Yeah, there's a direct link. Estrogen and progesterone are the two hormones that we talk about, and they can stimulate growth of fibroids. And this is why fibroids tend to develop during a woman's reproductive years, because these hormone levels are the highest, and then they often shrink like after menopause when these hormone levels decline. So there's a direct link with your hormonal levels. Well, I didn't mention it before. I said 70% worldwide, but 80% of blacks, including Nigerians and Africans and those in the U.S., will have fibroids by the time they're age 50. 80%. So this is something affecting a lot of fibroid surgery accounts for 65% of all gynecology surgeries in Nigeria. It's a very, very common, very, very common issue that it is tied to your hormonal levels.
Okay. Thank you very much, doctor. But why is it this common? I'm just trying to understand it, because if you're saying 80% of women, but why is it this common? Are we looking at maybe biological factors, environmental factors, lifestyle, or why do we have this really common? Especially in black women.
Yeah, the 80% was. Globally was by age 50.
Okay.
Black women are 2 to 3 times more likely to develop fibroids than women of other races, and we don't know the exact reason. Sometimes we think it's a combination of genetics, vitamin D deficiency, and maybe some lifestyle factors like stress and diet. They're even doing research saying some exposure to certain hair care products or environmental toxins may play a role. So really searching for the reason. What's interesting is that, when I was in the States, I would see a lot of white patients, majority white patients, and I just didn't see it as often. But it's the same amount that you'll see in the blacks in the States that you'll see in Nigeria. A lot of the genetics trace back to West Africa, blacks that are in the U.S. So it's just interesting. But yeah, we're looking at genetics and vitamin D and lifestyle, but it's hard to pin down what exactly causes it. Another one is early onset of menstruation. Maybe somebody starts their menses early. We've seen that they're more likely to have fibroids. But just because something, they say correlation does not equal causation, meaning just because something happens along with something doesn't mean that's the cause. It could just be coincidental. So I'm still in the research phases of that.
Okay. All right. Thank you so much, doctor, for explaining that to us. So let's look at some risk factors, for fibroids. Is it possible that because we have a lot of young girls who start menstruation very early, maybe at the age of 10 or even before 10, or delayed childbirth, does it increase the risk of developing fibroids? Or just take us through some of the risk factors.
Yes, women who do begin menstruating at a younger age, they are exposed to estrogen. You remember we talked about estrogen and progesterone earlier. So, when you start menstruating, that's when your hormone levels start rising. And so the earlier you're exposed to estrogen, in your lifetime, means that you're going to be exposed to it over a longer period of life. And we do know that estrogen increases the risk of fibroid. Higher levels of estrogen or just having estrogen increase the risk of fibroid formation. So just like women who have never given birth or they delay childbirth, give birth late, they're also at higher risk for fibroid formation. Pregnancy is protective. Most time I tell my women, if they always wonder if this fibroid is going to affect the baby. Like you're already pregnant. So as long as it's not a large fibroid that's going to compete with the baby for size, pregnancy is protective to some extent because it kind of stops slows down the woman's hormonal cycle and reduces exposures to fluctuations, and estrogen drops, progesterone goes up. So these are all things we consider while trying to determine a woman's fibroid risk.
Okay. All right. Thank you so much, doctor, for looking at that. So earlier you mentioned a bit about genetics. How does this play a role in it? So if I have a mom who has fibroids, does that mean that I'm at risk of having fibroids too later on in the future?
Yeah, genetics plays a significant role. If your mother or even your sister had fibroids, you have a 2 to 3 times more likely chance of getting fibroids.
Wow.
And, as we've been mapping the human genome and our DNA, we're trying to see if there's specific gene mutations that may be observed. All of these studies are currently underway, but knowing one's family history can allow for early monitoring and, if you're black and your sister or your mother has had fibroids, yeah, you might as well get a abdominal pelvic scan. This is just a scan of your ultrasound. It's not painful. It doesn't take much time. Sometime in childbearing a year. So 18 to 38 is prime time for fibroids. So for 18, that should be your birthday treat. Just go and check. It can really, anything we know early in medicine is better than learning about it later,
Okay. All right, thank you, Doctor. This is your Women Radio WFM 91.7. This is the program Radio Doctor right here on Nigeria's first radio station for women and their families. My name is Rose Yusuf Kaiser, and this morning on Radio Doctor we have Dr. Abiola Ajayi. He is the MD and CEO of ROA Specialist Hospital, and today he's consulting and advising on uterine fibroids, a common women's health concern. So you want to be a part of the program, please do well to dial 07000 917 917. You can also dial 09155 917 917. Send us WhatsApp messages with your questions, your concerns, or anything at all that comes to mind as regards to fibroids on 08155 917 917. You can also use the number 070 317 56537. We'd definitely love to hear from you, and let's not forget the doctor is also here to hear from you and to advise you accordingly. All right, so let's head on to symptoms and some complications that could come with fibroids. So, doctor, kindly take us through some of the symptoms, the signs and symptoms of one having, if a woman having fibroids. What are some of the earliest signs when it comes to fibroids?
One of the first, one of the most common symptoms, heavy menstrual bleeding. Right. During the menses, we have something called menorrhagia, which is heavy menstrual bleeding, and it's defined as bleeding that lasts for longer than 7 days. Or you're changing pads, multiple times in a day. Passing large clots is also some red flags. So if you're, I always tell when I do talks, if bleeding leads to symptoms like tiredness, dizziness, or that you're anemic or have what you call a low PCV, is significant, and it should be examined. In cases of fibroids, at times we have to remove them because the menstrual bleeding is so heavy that it really affects the woman. Like they can't go to work, can't go to school, could fall down when they stand up. It's significant.
Okay. All right. Thank you, Doctor, for telling us that. So, now we're looking at, heavy menstrual bleeding, if, one of the earlier signs of this. But how about, is it also the same if the fibroids is in different areas, let's say the cervix and all of that? Would that also bring about heavy bleeding? Because if we have fibroids in different locations, would that also, affect the amount of bleeding that a woman could get? Is that like a general symptom or sign when it comes to fibroid?
Very much so. To the point that that's why we talked about early screening. Your sister, mother has, by 18, start checking. An ultrasound takes, once you're pressed, meaning you have to urinate, you need to have a full bladder, but it takes just a few minutes. Because the submucosal type of fibroids can definitely lead to heavy menstrual bleeding. And if you now do a scan and we determine that those are the types you have, then either we can start you on some medication so that you don't bleed out too much, or talk about removing the fibroids.
Oh, okay. All right, thank you, doctor, for that. So, does it have anything to do with maybe pain during sexual intercourse for some women? Is fibroid in any way a cause of that?
Yeah, pain with sexual intercourse, that's called dyspareunia. I would like to give you the medical terms, but it's just pain with intercourse. And yes, very, very much so. Fibroids can cause persistent, meaning all day long pelvic discomfort. They can cause you pain during sex, especially if they're large. And we have something called a degenerating fibroid, where it starts to kind of liquefy in the center. It's too large for its blood supply, and those ones can cause not only bleeding but a lot of pain. You mentioned near the cervix. Fibroids near the cervix or in the lower part of the uterus. Those are the ones that are more implicated in sex pain during sex. So, and the patient, the ladies will usually tell me it's positional, like, oh, in this position is worse than in that position, and then if it's deep, it can cause more pain, and when it starts to impact your life or your relationships, these are when I now start counseling women on removing the fibroids.
Okay. All right. Thank you, Doctor. So, yeah, you can be a part of the program by dialing 07000 917 917. You can also dial 09155 917 917. Our toll-free numbers, our WhatsApp message lines are 08155 917 917. Also send a message to 070 317 56537. Those are the numbers to get in touch with us this morning on the program Radio Doctor. So, Doctor, untreated fibroids, what can it lead to? So maybe you're saying, oh, well, I'm not ready to give birth yet, or I'm not feeling any pain, or it's not disrupting anything in my body, so I'm just going to leave it there till maybe I'm ready to remove it. Could that lead to something much more maybe dangerous for the woman, or maybe a bigger health condition later on?
Yeah, fibroids are not just a woman's burden. They can actually lead to serious health issues for a lot of their body if left untreated. Just from the heavy bleeding alone, it can a woman can develop something called iron deficiency anemia, and a person that's anemic has low levels of blood. They're going, and when I say levels, I'm talking about PCV or packed cell volume. They will often complain of fatigue, palpitations, breathlessness, and just an overall reduction in productivity. And I see those symptoms. A lot, and a lot of times women don't know how bad it is until we do the test and see that their PCVs may be 27%. When we get to 25 and below, we start blood transfusions. So I see that a lot from heavy bleeding. I've seen fibroids that are so large and just in the right or the wrong place that push up against the ureter. Ureter is the tube that drains the kidney, and so it now causes urine to back up into the kidney. The kidney starts swelling, and as the kidney swells, it loses its function. It doesn't work better when it's larger. It actually works worse. So even seeing them, fibroids cause constipation, urinary retention, meaning you now can't urinate well, or you're waking up frequently at night, urinate. So yes, and yes, chronic untreated fibroids can lead to long-term complications.
Okay. All right. Thank you so much, Doctor, for giving us this very important information so that we're all aware, and of course we know what to do. All right, Doctor. So let's go to how fibroids are being diagnosed. I know you mentioned ultrasound earlier, which you said it's not painful, but what other means of diagnosis do we have for fibroids? Let's just get to know the diagnosis. How is this diagnosed, basically?
Yeah, I would think the most common way would be a pelvic ultrasound, and there's something called transabdominal, meaning the ultrasound probe is placed on your belly just above your bladder, or transvaginal, which is the probe is inserted into the vagina. Of course, it has a probe cover on it, and it's lubricated, but those are typically the first line tools, because they're affordable. It's not a surgery, and you should be able to find it everywhere. But an MRI provides better imaging. It's definitely more detailed than an ultrasound, and I don't mind doing them. A scan is fine for me until I'm trying to do surgery. Then I like an MRI, especially if the fibroid is pushing on a bladder or the kidney. You like to know the extent of what it's doing before you get into there, so you're planning. And then we have something called hysteroscopy, where you put a camera into the uterus. And remember those submucosal fibroids that we talked about that bleed heavily? That's a good way for determining them. But you can see all types of, almost every type of fibroid. Or let's say every type of fibroid with an ultrasound. MRI just gives you a better picture.
Okay, so MRI is like the most preferred, as it is, because it gives you.
Yeah, well, I would say for screening, we said people should start screening themselves early, right? So for screening, ultrasound is absolutely fine. If you're a black woman and your sister or your mother have fibroids and you want to start checking when you enter reproductive age, then an ultrasound is fine. Once we know that the case is complex, then we're going to be asking for an MRI. That's the best way to look at it. Because MRIs are expensive. An ultrasound of the pelvis can cost you anywhere from 5,000 to 15,000 naira. An MRI can cost you anywhere from 90 to 150,000 naira. So these are not close in, and so you can't ask every woman to go and spend 100,000 for something that may not be bothering them. So I reserve it for the more complex cases.
Okay. All right, thank you, Doctor. So now in this, on the program for Tuesdays, we get to do a lot of women's health, and there's a time we talked about adenomyosis and or ovarian tumors. But how do we then distinguish between fibroids and adenomyosis or ovarian tumors during routine screening? How do we, so that at the end of the day we don't call adenomyosis fibroids or fibroids? So what distinguishes them?
Yeah, early in my career I was taken on a ride by adenomyosis before. So the short answer is yes, they can be mistaken. Adenomyosis is where some of the the endometrial lining is when you have menses. That's what sheds. Right, so some of that endometrial tissue grows in your uterine wall, and it can mimic a fibroid, especially when you're dealing with cases of heavy bleeding. But this is now another good way where, if you want to differentiate positively between a fibroid and adenomyosis, now's a good time to use your MRI. So ultrasound and MRI together will help us differentiate those two, because I've seen many cases where the woman presented with symptoms of fibroid, and they now took them to surgery and couldn't find any fibroids. And so you now just cut somebody open because they had adenomyosis, put their life at risk, and it caused a lot of bleeding. Fibroid surgery or anything in the pelvis has a lot of potential for mishaps. So you try not to enter there if you don't have to. So this is where an MRI is useful.
Okay, all right. So it's definitely good to have.
The reason why I've not lost a surgical patient, no patient has died in our theater in 10 and a half years, was because of course, God is good. And number two, we sometimes require some of these tests just to make sure. Somebody can't just come in and tell me, oh, I have fibroids and I want to do fibroid surgery, and I just take their word for it. I'm not going to even take a scan from another place. I want to start my investigation from top to bottom and then make sure they qualify for surgery. It helps reduce unwanted or unneeded deaths.
Okay. All right, thank you very much, Doctor. This is your Women Radio WFM 91.7, and this is the program Radio Doctor, your free health consultation program where real doctors advise real people. And this comes to you Mondays through Fridays from 10 to 11 a.m. where we get to look at different health concerns right here on Radio Doctor. For today, we have Dr. Ajayi, the MD and CEO of our Specialist Hospital, and he's consulting and advising on uterine uterine fibroids, a common women's health concern. So you can be a part of the program by dialing 07000 917 917. You can also dial the number 09155 917 917. Our WhatsApp lines are 08155 917 917 or 070 317 56537. Those are the numbers to get in touch with us this morning on the program Radio Doctor. So yes, we have looked at what fibroids are. We've looked at risk and even where it is more common. We've talked about all of that. We've looked at symptoms and complications. We've looked about how it can be diagnosed. Now we're heading on to the fertility part of it. Let's understand how fibroids affects fertility and pregnancy. So, doctor, quickly take us through this, because that's one of the fear. I had a sister who was diagnosed with fibroids, I think about 2 years ago or so. And then she later on, when she went to the hospital, they told her that, okay, and she was not yet married. So what the doctor told her was that she should quickly get married and give birth before this thing grows too big, and it causes issues for her. So, and then she got worried because at the end of the day, it's not like there was a man at that time in the picture.
Ready and waiting. I don't like telling patients go fling yourself at somebody and get pregnant.
Exactly.
I personally don't say that, but earlier in the conversation we mentioned that pregnancy slows down the rate of fibroid growth and can even stop them from growing completely. So that's what they're getting at. But if you've seen somebody in a marriage that they weren't supposed to be in, you can see the misery. So I just don't like putting patients in misery. But it is true that if you have they say you found some fibers at 20. I don't know how old your sister was. Let's say mid-20s. If you were to get pregnant there, yes, then they wouldn't. They probably wouldn't grow. But when you're not pregnant, then they can start growing again. So, and everybody's fibers grow at a different rate. They grow in different places. So it's not as simple as seeing fibroids, go get pregnant. You have to take a few other things into account.
Exactly. All right, so but just let us know how fibroids affect pregnancy, implantation, maintenance, pregnancy maintenance, and the risk of miscarriage too. Let's get to hear all of that.
Very, very true. Fibroids, especially the submucosal ones we've been talking about, and the which cause heavy bleeding and stuff, and the large intramural ones. Intramural means inside the wall of the uterus. Large ones can distort the uterine cavity, the endometrium. That's where eggs go during ovulation. That's where sperm are trying to make their way to, and that's where implantation occurs. So if you have these types of fibroids that distort the uterine cavity, affect the endometrium, it can increase your risk of miscarriage. It can increase your risk of something called, I'm trying to use a non-medical word, placental abruption, where your placenta actually, you do get pregnant, but your placenta actually pulls off the wall of the fibroid. Even preterm labor can sometimes be attributed to large fibroids. And then the subserosal type of fibroids are less likely to affect fertility fertility or implantation, especially because of where they're located, and then usually their size. So the type and location matter greatly when you're evaluating a woman for miscarriage.
Okay. All right, thank you for that information, doctor. But does this in any way affect the outcome of, let's say, maybe fertility or even pregnancy for those who remove the fibroids, have the fibroids removed, and those who do not? How does this, affect the outcome of fertility at the end of the day? If you're able to remove it, and if you're not able to remove it, knowing fully well that sometimes, like you said earlier, it grows at different pace and different rate for people, for different women. So, could the outcome at the end of the day be the same? Because I know for that, my sister now, she's married, and God has blessed her already. But now, and I don't know if she removed the fibroids or not. I don't think we've spoken about that. As it is right now, God has blessed her, she's pregnant, but I don't know if she still has the fibroids or not. So would that fibroid affect the outcome of the pregnancy at the end of the day or not?
Yeah, and this is a great place for statistics. So, which I love. Fibroids, that especially the ones that affect the uterine cavity, right? So we've talked about those can affect implantation, affect pregnancy, preterm. So fertility rates. There was a study done not that long ago that showed that after myomectomy, fertility rates improved by up to 60%. And that's, in women with the submucosal or the large intramural ones that we talked about, but up to 60%. In the States, there was a study done where that women with untreated submucosal fibroids, their miscarriage rate was as high as 60%. Miscarriage rate now, 60%, compared to about 20% after myomectomy is the surgery to remove fibroids. So after fibroid removal, it went up. There were studies done even in Nigeria, the UI, or UCH. They showed that there were some women, the women that had infertility and fibroids after doing the surgery, 50% of them conceived naturally within a year or a year and a half, which is, that's a very significant. And one and done in Luth was about the same, 50% higher success in women. So it does matter where they're located, their size, even your age. So the success rate goes up, if you're under 35 when you have the surgery as opposed to over 35. But do they matter? Definitely, like highly, highly significant. And at times when I have a lot of submucosal, somebody's trying to get pregnant and they've tried now 6, 9, 12 months, then I'm talking more of surgical options at that time.
Okay. All right. Thank you so much, Doctor. Let's take this question that has come in on fibroids. Okay. There's no name to this, but she says that for a lady that has had fibroids removed, what she should do to prevent further growth. This is a WhatsApp message. So, Doctor, what can one do to prevent further growth? Because, like my sister's case, I'm telling her that she should go and marry and give birth, though, so that it will not affect her again. Now, for people that have done it and have removed it, and you mentioned earlier, so that it doesn't grow back, what can we do? Is there a possibility of preventing it from growing?
Yeah. So, once fibroids have developed, in completely preventing new ones or halting their growth, I'm going to say number one is difficult. But there are a few things that we've done to shrink existing ones or keep them from coming back. And first of all, you start looking at hormones. We talk about estrogen and progesterone levels. If those are high, it increases the chance that fibroids can grow. So sometimes we can reduce hormone levels. Especially if the person is not trying to get pregnant, in your sister's case. So another very useful one is weight management. Fibroids are twice as common in overweight and or obese women. So putting them on special diets or just reducing your BMI. Anybody with a BMI over 30 is going to be twice as common. Or twice as more likely to have fibroids. I mentioned earlier briefly about vitamin D, and I take vitamin D every day. It's got so many good qualities. It's been linked to fibroid development, so that 60% of women with fibroids were vitamin D deficient. Now, just because they were related doesn't mean it's caused, but it can't hurt to supplement vitamin D. So I do that in a lot of women as well. And processed meats, we try to remove those and replace them with green leafy vegetables and things like that. Then you can be exposed to estrogen in your environment. sometimes from certain cosmetics, sometimes found in plastics and hair relaxers. And if the chicken or the food you're eating was grown with a lot of steroids, at times that can, that could play a factor.
Okay.
I'll throw two more out there. Well, one more. Stress. There's a study that was shown that higher levels of chronic stress were linked to earlier onset and faster growth of fibroids. So I'm always talking about managing the stress. I'm always talking about meditation and this and that. It's useful for more than one issue.
Okay. All right, thank you, Doctor, for answering that question. You can also do the same by sending in your question as a WhatsApp message, or you can call in with the number 07000 917 917. You can also dial the number 09155 917 917. Better still send us WhatsApp messages on 08155 917 917. Or 070-317-56537. Those are the numbers to get in touch with us this morning on the program Radio Doctor. All right, Doctor, let's head on to treatment options now. What are some of the treatment options we have for fibroids? I know we've mentioned quite a few: surgery, maybe medications, all of that. But what are some of the treatment options and the safest ones to preserve fertility?
Yeah, so let me take your question in the opposite order. The safest one is what we call, to maintain fertility, mind you, is myomectomy. So myomectomy is a surgery to remove fibroid. That's still the gold standard. But you can do it open, meaning you're going to make an incision and, open the belly. You can do it through pinholes, which is what we call laparoscopy. And, but both of them, there's even an MRI guided, there's a procedure I've seen once or twice. It's not an open procedure per se. It's called uterine artery embolization, where some medically grade plastic pellets are used to block the blood supply of the fibroids. But not all of these treatments are meant for people that are trying to maintain fertility. More than likely, or more often than not, these are for people to try and reduce the symptoms. We mentioned heavy bleeding, fatigue, anemia, all those kinds of things. If I want to get pregnant, I'm still going to recommend a myomectomy or a surgery to remove the fibroid. It's your best bet.
Okay. All right. Thank you very much, Doctor, for that. So let's quickly look at some myth and misconceptions. Now, we have a lot of growing trends, of women turning to herbal or detox products for shrinking fibroids. Now, from, a clinical standpoint, do all of these things work, and how harmful are they? Because sometimes you get to see different kinds of adverts. Oh, this one will shrink your fibroid, this one will come off fibroids. You want this one cut. So there are a lot of, herbal drugs, or even not herbal, non-herbal drugs, but do all of these things work? And sometimes, what effect does all of this have in the long run, in our bodies?
I've seen all manner of things in Nigeria treating fibroids. You talked about herbal medications or herbal products, or I've even heard of a procedure where and this is not a clinically trained doctor. This is one of your, men, these Babalawo. I don't want to name their group, but these, traditional kind of people, and they insert something into the vagina, and they say that now they're pulling out the fibroids, and all of that stuff doesn't work, and it can be harmful. I've seen more than one woman where, because of whatever they inserted into the vagina to dry up the fibroids, the entire vagina closed or partially closed, so that no more than an inch, finger, penis, anything could get into the vagina. Yeah, I've seen it more than once. the best case scenario is that your money gets taken. They take your money, nothing happens to you. But in terms of medication that is going to reduce the size of the fibroid, there's a few, maybe two, and these are injectables that are prescribed by a medical professional, and they are going to reduce your fertility. So if you're trying to get pregnant and reduce fibroid with a drug, you're going to go in the wrong direction. And there is no drink or herbal concoction that's going to help you with fibroids to cure you. And your best case scenario is that you just wasted your money.
Oh, that's sad. I just hope that we're able to learn from this, because a lot of women fall prey to all of these clinical tested drugs that are just flying all around, just in a bid to look for solutions. And the worst of all is that sometimes you have some women who believe that it is spiritual. So when women come to you, doctor, with all of these kinds of talk and complaints, what's your advice to them?
Yeah, you're right. Some women believe fibroids are spiritual attacks or by supernatural forces. The way I practice now or advise them is very different than early in my career. Early in my career, I would just say that's nonsense, that's this or that. But belief systems are deeply personal, so I, recognize that. But it's important to distinguish between spiritual beliefs from medical facts, and that's why I like statistics. Fibroids are biological; they grow in your body. They are hormone-dependent tumors. They're not spiritual afflictions, in my opinion. And when you seeking medical care is not a sign of lack of faith, or in your pastor or your church or whatever your mother or your grandmother got for you. It's seeking medical attention. It's smart to do. And in fact, early diagnosis, the early screening we talked about can preserve, and treatment can preserve fertility or improve fertility, reduce your suffering, and save lives. Doing surgery for a large fibroid is very different than doing surgery for a small fibroid. It's more bloody, more chance of death, more anesthesia time. All of those things play a factor. So, yes, I want to recognize that belief systems are deeply personal, but please seek medical attention from a licensed physician. That's why I am always free to help. I know we're going to have to go soon. You're going to give all my details. Anybody with fibroids, come, we will help you. Okay. Just mention WFM.
Okay, great. All right. So the key word is WFM. I hope all of you are hearing.
Exactly.
All right, doctor. Thank you so much for being a part of our program and for advising and consulting on uterine fibroids. Do you have any other thing you would want us to maybe know about, or you want to let us in on it as regards to fibroids?
I don't want people to be afraid. So, I always like helping women. Let's say 15, come in, you can get a scan, see the fibroids, talk, no charge. Just get, let's go. Let's improve our fibroid talk out there. Let's make it less of a taboo to go and see a doctor, and just mention WFM and we'll take care of you. Thank you very much for having me.
All right. Do want to enjoy your weekend, doctor. Thank you.
Same to you.
Okay. So that's it on Radio Doctor today, and coming from Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. Now, for consultation, you might want to grab a pen and a paper to get this one. So you can reach Dr. Abiola Ajayi via the website www.theroahospital.com. All right, ROA is in capital letter. Every other word is in small letter. So www.the in small letter, ROA in capital letter, hospital in small letter, all in one word.com. Okay, so that's the website, or you can do that by dialing 0913 579 5108. Okay, 0913 0579-5108. Now, another hotline that you can call is 0808 886-2635. Okay, 0808 886-2635 for an appointment and direction. And remember, when you get there, just say you listened from WFM and you were there to see the doctor. I'm sure they will definitely take very good care of you. All right, so you can also read the doctor on other social media pages. On Facebook and Instagram is at ROA Specialist Hospital. Facebook and Instagram, ROA Specialist Hospital. On YouTube is at ROA Hospital. And on X is on, you can find them at ROA Hospital. So thank you all so much for tuning in and listening. And to you who sent in a question, we appreciate all of you. Now, Radio Doctor on Women Radio is Nigeria's first specialized radio health program that comes to you Mondays through Fridays from 10 a.m. Join us again on Monday morning, where we'll be going through with children's health right here on Women Radio. Thanks to the producer of the program, Aisha Sani, and the executive producer, Tom Okewale Shunaya. My name